As South Africa's coronavirus infections continue to skyrocket and Gauteng considers tighter lockdown restrictions, the focus has somewhat now shifted to our health system and whether it will be able to cope. Health authorities and hospitals need real-time data on the current situation, and at the onset of the pandemic, the Data Science for Social Impact Research Group developed a dashboard that allows for real-time assessment of South Africa's COVID-19 pandemic. The information was made available for machines to read, enabling scientists to effectively model infection rates and conduct scenario planning. Another important use of the dashboard is to assess the local hospitals and clinics for space in ICU units and high care facilities. Dr. Vukosi Marivate is the chair of the Absa Data Science Department at the University of Pretoria and joins us now live via Skype from Pretoria. Doc, thanks very much for your time and welcome to the AM report. So often we hear so many predictions, I struggle to believe that any South African is keeping up. Perhaps as a start, help us distill the information by giving us a sense of how the beds and the capacity, particularly in Gauteng, are faring as, of course, we approach the peak of the pandemic in the province.
Good morning, Anne, and also to the viewers. So at the moment, as per the MEC statement yesterday, they are still keeping track of actually what's going on in terms of ICUs, isolations, and high care. It is a situation that is developing, and also the update from the leadership from Charlotte Matkeke also went through what is actually going on there. One of the things we should understand in terms of raw numbers, we don't have numbers that yet are being presented by Gauteng that you have in terms of ICU, the utilization as much that's in public. So that's why we don't have it even on our database and also our dashboard. But we have had also rapid expansions of ICU beds for COVID specifically, but also trying to manage the whole capacity of the healthcare system. Remember, it's not just COVID patients that need care, right? There are also other people, and you kind of you become concerned if then you just then overhaul the whole system just to take care of one disease and then neglect the others. We might then have other people being affected by COVID, but actually not having COVID, kind of in a way. Yesterday's briefing, we just went through some of these the kind of realities of what's going on currently at the moment, and our group, as well as the advisory group to the Premier's office, has been assisting in ways to actually think about how do we get this information into one space in terms of the ICT infrastructure, and then after that be able to disseminate it back to all the hospital management and the clinicians on the ground. So those were the discussions that we've been having and also advising on.
Right. And speak to us about, I guess, the role of data modeling in trying to control a pandemic. I mean, on the one hand, we're told the numbers will forever change as more data is fed into the system. But on the other hand, very long-term decisions are being made based on this data. Give us an idea of how South Africans should be responding to these figures.
Yeah, so one of the things that we did going at the beginning was looking at the challenge that we had, the minister, the MECs, the premiers releasing statements on a daily basis of, okay, here are what the numbers are, here's what the growth is in specific areas, but this wasn't in a central place and in an easy way for a machine to read, or what we call machine readable. So you can think about it that you want it to be in something that looks like a spreadsheet, that other people, such as scientists and modelers, can be able to easily grab this data and use it. So we came up with a process. We got contributors also and collaborators and volunteers who work every day to actually scour all the different official sources of data. So one of the things that's important is that we need to make sure that all the information that's made available is actually from official sources. It is not like, just somebody being quoted as saying X, but actually can be traced back to people like the NICD, the MRC, the National Department of Health, and the Gauteng Department of Health. Once this data is available, then scientists and modelers and analysts can then do their analysis and do their work, and then from there they're informing different decision makers in different places. One of the things that's very important at this time of the spread of the disease is now understanding the local situation. One, we kind of reached a plateau in terms of the number of tests that are being done every day. So our case finding rate, which is how many positive cases we get per test or per 1,000 tests, is increasing. This should give us a warning, especially here in Gauteng, that likely the prevalence of the disease is much higher than what actually can be tested. Right, so we're not having, it's not a direct number to say these are actually the amount of people that actually, there's more people on the outside. And as that case finding rate is getting higher and higher, we are seeing now that we're moving closer and closer, likely to the peaks around Gauteng and what's going to happen. In the modeling, yes, it has been said that we might have 4 to 6 weeks before we reach peak around Gauteng, but we all have to be vigilant, right? There is information that's down now from Gauteng down to districts and sub-districts, so you can look at around your neighborhoods what the numbers are, and mostly look at the trend, not the raw numbers. And you can see that we're having this kind of looking like exponential growth in these spaces, and this is multiple things that are coming in. So one, we've reopened work, so people are being back at work. If you're in an area where you're having to be enclosed, and mostly because of the respiratory disease, it's actually transmitted through you breathing in and it getting into your, into your respiratory tract. So those are the things that are becoming more and more important. So again, we're the appeals to say, let's all socially distance. If you can work from home, work from home. And those things. And the data mostly should be read on the patterns, not the raw numbers, I don't think, at the moment.
That's very interesting you say that, because, it's in some respects part of my next question. Often we reflect on the number of infections, the number of fatalities, and the number of recoveries. Now and again, we'll dabble in the active cases. Does this go enough in telling the full story of the pandemic?
It's almost like, you have your field of vision, and what you see is the numbers that you get given, kind of in a way. There's many more things that are going on in the background. Just like at the beginning you asked, we're hoping that we will get to a point where we're having more detailed information. We do have information from National that gives you a daily view of how many ICU beds are being used and hospitalizations. And every week we do get these reports from NICD that look at the status of hospitals. But that's going to become more and more important as we get to decision makers having to make decisions within hours, right? You were talking and thinking about, there's long-term decisions. But we're getting to a point where these decisions have to be made very quickly, just because hospitals are going to have to share resources between each other, right? The MEC, Dr. Bandile Masuku yesterday, referred to the fact that the private and public hospitals have to work together on that part. So as we're looking at this, the trends are the thing that's alarming us. So we are in community spread, and we're seeing how fast it's going, right? The modeling team that's been working with some of the data at VETS, the ones at National, they've been looking at this and then seeing how actually this is going to go high. But then now they're trying to go in and say, okay, fine, if this is going on, how then do you change your planning in a hospital? How do you change your planning in terms of non-pharmaceutical interventions? What other things can the Premier, as you was alluding to yesterday, do in such a way to encourage that people aren't moving around too much? They are not in spaces where they could actually transmit the disease to each other.
Right. You speak about trends. Often experts cite the RT number. Now, at the risk of going into quite a complex conversation about statistics, in layman's terms, what is this figure and what does it tell us?
So the RT is somewhat something similar to, we have a reproduction rate of a disease. So if one person gets it, how many people will they actually transmitted to? In general, when you're calculating it and trying to keep track of it, you would like to be 1 and under, meaning that one person gives it to less than one person on there. When you're over 1, you tend to think that you're not controlling the disease because the spread is still high. So when we're looking at all the interventions, we had lockdowns, we've had restrictions on specific trade and all those things. One of the things that you're trying to do is keep that reproduction number low. Right, because if you can put it under 1, basically after a while the disease itself just dies out because it's not transmitting to other people. But if you're over 1 or even towards 2 and above, it means that is still wildly kind of propagating. So we do keep track of it as more, again, the trend, not the absolute number, just to understand what is actually going on. So once we started seeing kind of that there was some community spread and people have started noticing the numbers going up in a place like Gauteng, what we're doing is we're looking at that and saying, okay, so we're in a point now where now the trend is going up. Right, meaning that there's a lot of transmission that is going on. And what you want to do is that when you want to feel a little bit safer, you want that trend to be way under 1, not above. You have people like countries like somewhat in the US, minus the way that they're handling the pandemic itself, trying to keep track of that across all of the states in there. So also we're trying to see how we can actually keep track of that across all the provinces and areas, just so that we can have a understanding of the pattern that is going on. You don't look necessarily at the raw number, but you look at the pattern of, okay, are our interventions actually trying to reduce this number, or is it actually going up?
Yeah, and very quickly then, the obvious question is, how is the RT trend looking for our country? I mean, I imagine, given your explanation, it must be above 1?
It differs per province on that part, and that's the best way to kind of think about it. I think in Gauteng we've been kind of going up and down, but even with that, we are kind of around that 1, between 1 and 2. I think is the best way kind of to say it. So we're not yet in out of the woods as it is. So we are still going to say keep socially distant. If you can work from home, work from home. Try no visits on there. People tend to think that scientists, numbers are just numbers. It's not. It's people, right? So getting the reports every day of the deaths is not something that we're not happy about. It's you really are trying to see how much as we can actually inform all of the decision makers in such a way that they can also inform the public in trying to reduce these infections. There will be kind of more cases coming up. There will be more deaths, and it's very unfortunate, and we don't want that to happen. But that's where we are right now. We're in this point where Gauteng has to deal with this. As the saying's been going, we are in the eye of the storm now. And we can't say it hard enough.
And it's on that note that we're going to have to leave it. Thank you very much for getting us into the picture so well. Really interesting insights there. Dr. Vukosi Marivate is with the Absa University of Pretoria. He's the chair of the Data Science Institute at the University of Pretoria. Thanks very much for your time, Doc. Certainly appreciate it.